restriction. National advocates say it violates civil rights.
And this is a really unprecedented, egregious restriction in coverage, and it really impacts people who are trying to go to work, go to school.
New York State officials say it's not a lifetime limit, but a benchmark. Insurers can offer more, but Bastian says they don't.
There are no other plans that offer any other coverage.
Medicaid and Medicare cover repairs and replacements, so does the VA. But for the 3,000 new amputees in New York State each year, their first prosthetic device may be the last one insurance covers.
It doesn't make sense. Why would you punish somebody? You're not getting the insurance for free. You're paying for it.
He asks what should qualify as an essential health benefit, if not a limb. In Albertson, Long Island, Carolyn Gussoff, TV 1055.
So how can this be? Joining us now is Dan Bastian, who lost his leg 25 years ago. He's also an artificial limbs maker. Welcome to the show, Mr. Bastian. And you could see from Carolyn's report, we're kind of going in circles trying to figure out who's responsible for setting this state limit. Are you able to shed any more light on that this morning?
Well, thank you, first of all, for having me today and shedding light on this information, this important issue. What had happened was when the Affordable Care Act went into effect, states were mandated to come up with health exchanges. New York State chose a plan of the Oxford EPO plan as their benchmark model, which was a stripped-down version of insurance. In that plan limited prosthetic coverage to one limb per lifetime, and it simply propagated through the system without anyone realizing this was going on.
Well, and you hear we get the insurance companies saying us that, you know, the state sets the guidelines, and then the state telling us that, well, the insurers can offer more, and the insurers and both the states saying we have to be affordable. This seems like it's falling right through the cracks, though.
Exactly, it's falling through the cracks. I've been meeting with legislators up in Albany, 30 senators and assembly people, and individually, and every one of them was shocked by this. They had no idea this was going on.
Well, shocked, but are they going to do anything?
They promised me after the budget's passed that they're working on the budget, that they will be addressing this issue because they know it's a problem. As far as the cost goes, I have multiple studies that have done in other states around the country, and it comes out anywhere from a low of 28 cents per year per member to a high of $4.20 per year.
Really? That low? I think most people would find that not that large of an amount, because when you hear how much they cost, you think this could be a very expensive thing. I heard the range there was $5,000 to $100,000, and why such a wide range?
The range is based on the activity of the patient, what they're planning on doing with the prosthesis. If it's a microprocessor controlled leg, is it a foot ankle system, is it an arm? Because a below-the-knee prosthesis is going to cost a lot different than an upper extremity prosthesis, an arm.
Well, now you're in this business, so some people say, oh, well, you know, you're upset because, you know, this is your business, but this is personal for you, too. You're a certified prosthetist, but you've also gone through this.
Right. My amputation was 25 years ago after I was diagnosed with cancer 35 years ago.
Which leg?
It's my right leg. It's completely amputated from basically my hip down. The whole leg is gone.
I saw you walk through the lobby. You look like a young man. I didn't even recognize that you were going to be speaking about this issue because I knew you'd lost your limb this way. Yeah. But how is it that you've had such a remarkable recovery? But what are the challenges that you face, and how often do you need a replacement?
Well, my initial prosthesis was 25 years ago. Since then, I would have to say it's been about 15 to 20 prosthetic devices for me.
15 to 20 replacements?
Replacement sockets or some of the components. A prosthesis lasts anywhere from 3 to 5 years, and that is verified by Medicare. That's the standards for the government.
That's a surprise. I think most of us thought these were long-lasting devices.
Well, if you're walking on a device and you're pressing down the carbon every step that you're taking, eventually it's going to wear out. It's not our bodies, it's not regenerating itself. And as far as the fit of the socket, which is the most important part, your entire body changes every 7 years. Every cell's been replaced. If I look at a picture of myself 7 years ago, I'm very different, unfortunately.
How important is this to your life?
Prosthetics, if I didn't have this, if I didn't have an artificial limb to be able to do it, I'm a co-owner of Progressive Orthotics and Prosthetics. I've coached all my son's baseball teams and football teams. I've coached my daughter's basketball team. I'm on my feet all day, and I'm helping people who are suffering from limb loss. So that's why I got involved, is because someone needs to speak up about this, and nobody was doing anything. I had a patient last week in my office that came in, and I had to explain this to her that she had this covered. She broke down and started crying. 45 years old, and she has this coverage. What is she going to do? How is she going to get another prosthesis when the limb changes? After someone's limb is amputated and they get their initial prosthesis, the swelling comes down. The muscles atrophy because they're not actively controlling the body part anymore. It's just normal nature that it gets smaller.
So you've got clients that are being denied a replacement limb?
Absolutely.
Now, I would think once you've had a prosthetic, to try to think about having a life afterward without one, that's unthinkable.
It's devastating for these people because they don't know what to do. They've gone back to work, and this is all just through private insurance. It's not Medicaid, it's federally, it's not Medicaid, and it's not the government plan. But these people are working full-time, like myself. I have one limb per lifetime coverage.
You yourself are facing this restriction.
Myself,
and you've had 15 to 20 replacement operations.
Now, exactly. I've had a total of 34 operations in my life.
Wow.
A lot of residual changes to my residual limb.
Well, this can be expensive for the insurers, so people understand that, and you know they're expected to cover everything and yet still make it affordable. How does this compare to other plans that are out there, though, for other people who have insurance that are not part of the state health exchanges?
Medicare fully covers prosthetics when they are medically necessary. Now, a prosthesis...
Medicare does that.
Medicare does, and so does Medicaid.
And how do most Medicaid, how do most private plans handle this? Do they put that kind of limit on it?
Prior to the Affordable Care Act, the limitations were based on each individual plan. But there was only one plan that actually had this one limb per lifetime clause in it. Other plans may have had a monetary restriction, $5,000 per year, $10,000 per year, but they didn't have one limb per lifetime restriction. So the plan that I had before the Affordable Care Act, I had full prosthetic coverage. And since my plan didn't meet the Affordable Care Act standards, I lost my insurance.
And so you had to go to the state health exchange.
I had no other option.
Well, we know you got a petition. About 6,000 people have signed up.
A little over 6,000 people at this point right now.
And we'll see whether or not it does get taken up by the legislature. This one lifetime limb, prosthetic limb that is on the state health exchange. It's an exception a lot of people are shocked by. Dan Bastian working to see what he can do about it. Certified prosthetist. Thanks for coming in and talking to us about this.
It was my pleasure.
Today.
I appreciate the time.
All right, thank you very much. And of course, we will watch for any changes to the state program. But up next for you, dangerous driving caught on camera. The biggest distraction for teenagers besides cell phones.